Hello guys, quick summary about the different types of periodontal disease, but if you guys want to first check all the characteristics of gingivitis, we have a video only summarizing all the aspects of gingivitis. Go back to this video, I will add the link to the top right corner of this screen, it will show up at some point, okay? So without further ado, let's first review the structure of the periodontal tissues, of course. And take a look at this. You have here the top of your soft tissue limit, okay? So this is the gingival limit of this tooth, and then you have the bone limit of this tooth, okay? The alveolar crest. Very good. What we have in between is something very interesting and you guys need to know. First, we have the gingival sulcus. Take a look at this. The name of this space between the epithelial tissue and your tooth is, of course, the gingival sulcus, okay? Now you have the sulcular epithelium, and then take a look at this. Now, after the sulcular epithelium, you have this epithelial tissue, very important epithelial tissue protecting the periodontal complex, and that's the junctional epithelium, in average measuring 0.97 millimeters. According to articles in the literature, we are going to cite some of them. And then we have the connective tissue attachment, which is in average 1.07 millimeters, of course. Those two together are the biological width. Therefore, biological width plus the gingival sulcus are the distance between the gingival limits of your tooth and the bone limits surrounding the tooth. So there you have it, all right? So this is exactly the periodontal tissues surrounding the tooth and the root. Very good. Of course, here we have the cementum. It's part of the periodontal complex, and then the periodontal fibers. Of course, you need to imagine that this is surrounding the entire tooth. Of course, that's just a schematic drawing. And then the alveolar bone, of course, right? So the alveolar bone. What happens is that in the gingivitis, we have some inflammation, the redness, and characteristics like that. And then with the periodontitis, we have apical migration of this epithelial tissue here. And then we have not only gingival recession, but bone loss. So we have bone loss, and this is the main characteristic of periodontitis. We are going to review those now, all right? So let me remove now the notes that I was doing. Okay, very good. And now let's see this amazing table. So gingivitis, you can pause the video to study if you want. Gingival inflammation, redness, swelling, just like I told you. And of course, that's caused by dental plaque accumulating along the gingival tissue line, of course, right? And then it's fully reversible, of course. Periodontitis, then you have apical migration of the junctional epithelium, loss of attachment, deep periodontal pocketing. So now what was a gingival sulcus is now a periodontal pocket, because that's more than 4 millimeters. Don't forget that the normal gingival sulcus varies between 1 and 3 millimeters. So now you have periodontal pockets from 4 millimeters onwards and higher than this. Alveolar bone resorption, so you have bone loss as well, and that's the main characteristic of periodontitis, all right? And this is no longer reversible, but we can stop the disease. Necrotizing periodontal disease, when we have gingival necrosis and things like that, then the patient is systemically compromised. Don't forget about this. Systemically compromised patients always show more intense alterations. So now you have the more bleeding, of course, tissue destruction, and then this happens faster than in normal reacting patients, of course, and this can be associated with HIV, as you guys are seeing on the table, okay? So immunocompromised individuals. And then there is periodontitis caused by other diseases as well, including genetic alterations, like Down syndrome, for example. It's one of the alterations of patients of Down syndrome. Now let's see an example. So this is gingivitis, of course, around a tooth that is broken. Now you have bacteria there, especially where you have the distal surface, where it's more broken than the rest of the tooth, and it's broken beyond the line of the gingival tissue. Therefore, you have more bacteria, and now it's red, showing that this is the red of inflammation, of course. All right, after restored and everything, then, of course, you're going to take care of your patient, clean first and even later, rehabilitate the patient. This is a complex rehabilitation. It's not the topic of today. And then look now the amazing keratinized gingival tissue surrounding these teeth. Okay, so there you have it, with the colors of the oral mucosa of the patient. So there you have it. All right, now you have something different. You have periodontal disease. Look, the apical migration of the epithelial. So you have the gingival recession, of course. Then you have even caries because this canine is rotated and maybe the patient was not brushing. There you have it. Okay, and all these aspects of a little bit swollen, and here it's not red, of course. So not all the patients will come with a red gingival tissue, but when you probe, then it starts bleeding because everything is inflamed. So that's why you are always going to probe your patients. After the extraction, then there you have it. You know, the caries on the lateral incisor, of course, due to the bad position of the canine, and of course, insufficient hygiene of the patient. And then we have the staging. So again, pause the video if you want to review this, to study. Mild periodontitis, moderate periodontitis, severe periodontitis, and then advanced periodontitis. How many teeth the patient lost due to periodontitis? So this is also part of the classification here. Then even after the periodontal disease is treated, if you still have furcation involvements like this, it's difficult to maintain this tooth, but of course you can try to be conservative, and at least the patient has some keratinized tissue here, and there you have it. Okay, so the tissue is looking better, but don't forget you have exposure of the furcation, so you have a furcation exposure here. All right, and even the molar is over-erupted, so even to rehabilitate this patient, it's more challenging because if you just do a crown below, there will be no curve of Spee, right? So technically, this is a complex rehabilitation. But all right, gingival recession. And now the last slide of today, we have the grades. Why we have these grades? Because we need to estimate the risk of future progression of the disease, right? That's why even smoking is being considered here in this classification, because the more the patient smokes, then the disease is predicted to have a higher risk of progression, all right? There you have it. Grade A, slow rate, grade B, moderate rate, and then grade C, rapid rate of progression, including bone loss and all the factors being taken into consideration, like the modifiers, cigarettes, and other factors like this, all right? See you guys very soon.